is Natalie Cantrell, and I'm a student at Mississippi University for Women in the RN to BSN program. This evening I'm going to talk to you about antibiotic resistance and the antibiotic stewardship program that is in place in hospitals to help with antibiotic resistance. I'm going to ask a question. How many of you have ever had like a cold or something going on and you just had some antibiotics laying around at home, so you just took them, just to take them, to keep from having to go to the doctor? Okay. As most people have, and I'm guilty of doing that myself. As you can see on this slide, quick introduction, antibiotics are very helpful and they help to transform medicine. Proper administration of these antibiotics, as you can see, it will help to save lives. It decreases infection and decreases morbidity, which means it will decrease multiple conditions that you can have going on within your body. Decreases sepsis and, like I said, infection. Proper antibiotic use will also help to make other medical advances possible. Antibiotic use is very important with chemotherapy, with a cancer patient, and also is very important with organ transplant patients, because it's very critical that they do not get infection after they receive a new organ. Rapid administration of antibiotics will help to manage and decrease the chance of sepsis, which sepsis is very, very severe infection. A lot of times will lead to death if not treated properly, and that's a very common thing that we see in hospitals, sepsis. Nearly 20 to 50% of all antibiotics that are prescribed in the healthcare settings are unnecessary or not needed. For example, you go to the doctor and you have the flu, or they tell you you have some type of virus. A lot of physicians and clinicians will just prescribe an antibiotic, which, as you probably know, viruses cannot be treated with antibiotics. It's just not going to help. And a lot of antibiotics have negative side effects, such as C. diff. I don't know if you know what C. diff is, but it's a very serious type of diarrhea that comes from taking too many antibiotics, and it kills the good bacteria in your belly. The misuse of antibiotics, unfortunately, has led to a very high prevalence of antibiotic resistance. We see this in the hospitals a whole lot in the form of a condition called MDRO, which is multi-drug resistant organism. And it has been estimated that more than 2 million people have been infected with antibiotic resistant organisms. With MDRO, what we see is that, like I mentioned at the beginning, people will just take antibiotics for a condition that they have going on instead of actually going to the doctor and receiving the antibiotic that targets what's wrong with them. So in the hospital, when we get somebody who's MDRO and they've got a superbug that we call it, we have to do blood cultures and an array of tests to determine what type of infection they have so that it can be treated with the correct antibiotics, because they're resistant to so many other things. Very common problem. I mentioned at the beginning that a lot of hospitals hold antibiotic stewardship programs. These programs are put in place to improve treatment of infections, and it reduces negative effects that are associated with antibiotic usage. This will help to reduce antibiotic resistance and also the C. diff infection that we see. It improves the quality of patient care, it improves patient safety, it reduces failures of treatments, and it increases the infection cure rates. Just give them antibiotics just to give them, it will cause your treatments to fail. It won't be a good treatment for whatever you have going on. The CDC in 2014 recommended that all acute care facilities, which is just your hospitals, implement this antibiotic stewardship program. It helps to decrease side effects that are associated with antibiotics and also antibiotic resistance, and it helps save money because you're targeting a specific infection with a specific medication as opposed to just giving an antibiotic just because. So this is kind of a chart showing you how antibiotic resistance happens. There are many germs that are present out there. Some of them are drug resistant, and that I mentioned earlier, in the hospitals we do blood cultures and different tests to determine what medication will target this particular infection. Antibiotics will kill the bacteria that are causing you to be sick, but as you can see here, they also kill off good bacteria that protects the body from infection. That's why you get C. diff, why you get superbugs that make you sicker and then you can't take anything for them. The drug-resistant bacteria at this point, they grow and multiply, because as you know, a lot of you are familiar with medical jargon, but a lot of these bacteria these cells will multiply and they will grow, and eventually it takes over your body, and then after that, your body is resistant to many different types of drugs because of this bacteria, and it causes more problems. So, with these antibiotic stewardship programs, there has to be a leadership commitment in place, and it dedicates necessary financial, information technology, and human resources. That way, there's not antibiotic resistance that's present within the hospitals. With drug expertise, what they do is they appoint a pharmacist, a leader, one pharmacist that is in charge and that is responsible for improving antibiotic usage. They manage dosages, they manage routes, they manage correct medication for the correct infection. With accountability, they appoint a leader that is responsible for the outcomes of the program. And experience with these programs and proper education will show that a physician is qualified to lead these programs. Action taken, it's very responsible for implementing at least one action that is recommended. This can include evaluation of ongoing treatment after a period of initial treatment. So you have an initial treatment, and with this action, there has to be an evaluation in place after the initial treatment so that you can proceed with that treatment. Tracking is very important because it can help monitor resistance patterns within patients and within their antibiotic usage. It also helps to monitor the prescribing of antibiotics so that they're not overprescribed or even underprescribed or the wrong things given. With reporting, you have regular reporting of information on antibiotic usage and resistance to nurses, doctors, and relevant staff, which are going to be the ones that are in close contact with these antibiotics. Nurses administer the medication, doctors prescribe the medication, your pharmacy techs, they fill the medication, and your pharmacist looks over the medication. With your education, if you will educate clinicians, your doctors, about proper prescribing and resistance and proper protocols with antibiotics, it can help to drastically decrease antibiotic resistance. And as you can see here, between the years of 2000 and 2012, with your antibiotics, which you got some here that didn't have much of an antibiotic resistance rate increase, but with these others, you have anywhere from, like I said, between 2000 and 2012, a 17 to 25% increase in antibiotic resistance. So, some policies that support antibiotic usage. We develop and we implement facility-specific treatment recommendations. This will help us to choose the right antibiotic and the proper duration of antibiotics and how long they need to be used. These recommendations are based on national guidelines, policies that have been put in place, particular formularies put in place by pharmacists, and local susceptibilities. Documentation, which we learned in nursing school that if you don't document something, you didn't do it. And a lot of people in the medical field know what I mean when I say that. But documenting the dosage, duration, and indication of all these medications will help to identify the course that you're taking with these antibiotics. It helps to ensure that antibiotics are being watched as they should be and that they're discontinued when they should be. If you have a patient comes in initially with a white cell count of 25 and you start them on an antibiotic that is specific to their condition, once that white cell count gets within normal limits between 5 and 10, and you no longer have any indications of sepsis or infection, or you don't have any positive blood cultures, those antibiotics should be discontinued. That's why we use documentation. And as you can see here, these are just some pictures of different antibiotics that are used in the hospital setting. The majority of antibiotics used in the hospital setting are intravenous, used in the vein, as opposed to by-mouth antibiotics that you see when you go to the doctor's office. Education is key with antibiotic resistance therapy. So with education, We can use facility-specific information and protocols that will help the doctors improve prescribing, and it will even help nurses with administration of these medications. So, certain presentations, we can give education through posters, flyers, newsletters, electronic communication such as emails to particular staff groups. And we also can review cases, maybe patients that have been in the facility but have been discharged, where they developed a superbug or drug resistance within their body. We can review these cases and do some research as to where we could have made changes in their antibiotic therapy. Maybe picked an antibiotic that targeted their condition more specifically. We can also use web-based educational resources, some healthcare research, websites, just different things to help prevent antibiotic resistance. Education is going to be the most important tool in measuring these outcomes. It will be the most effective that we could use to make sure that antibiotic resistance doesn't happen frequently in our facilities. These are, I know it probably doesn't matter to you guys, but these are some references that were used within my research and presentation here. So I want to thank you all for coming tonight.